Well, hello everybody. My name is Peter Werwine. I'm senior editor at Managed Healthcare Executive. And today I'm speaking to Adam Block, who is an assistant professor of public health at New York Medical College in Valhalla, New York, which is in Westchester County. And this week we're publishing a paper that Professor Block and his co-authors wrote about the profits of health plans amid the COVID-19 pandemic. The precise title is Publicly Traded Health Plan Profits Surge Amid Requests for Higher Rates. So thanks for taking the time to talk about your paper today.
My pleasure. Happy to be here.
So as we were talking before we started to record, this paper might be subtitled A Tale of Two Cities. You begin by discussing what's happened to providers in the pandemic. The overall picture, it seems, is because of the reduction in utilization of medical services, many, maybe not all, but many providers have seen a huge drop in revenues, and that's stressed several of them or several categories of them.
Yes, absolutely. I think that's what we have seen, and we have seen that there's plenty of evidence of this in terms of hospitals furloughing some of their employees, requiring pay cuts across the board for other sets of employees. And the idea is that this is a public health crisis, and what we would expect to see is that while lots of other portions of the economy are suffering, travel, hotels, vacations, restaurants, that the doctors and the other healthcare providers out there would be doing financially very well, but that's actually not the case. And what the case is that because only a portion of the revenue that comes into these organizations is through, something like acute care due to COVID, the large portion of the other revenue comes from elective surgeries, and all of those elective procedures have been either delayed or stopped for a period of time. And that has caused a major disruption to the revenue flows of these organizations. And so what they're seeing is the financial repercussions of that.
Yes, and on the other hand, CARES Act money has flowed to them. And I think as you discuss in the paper, some provider organizations and some types of providers have done better with respect to CARES Act money than others. As I recall, you say that a large percentage of Medicaid providers did not see CARES Act money.
Yes, that's right. The way that the CARES Act money was distributed was based on Medicare, basically the number of discharges and Medicare reimbursement. And so if you're a provider that doesn't have a huge Medicare base, you were getting less of a share of the CARES Act. And it also depends, because providers were getting a large share of COVID, but it also depends on how quickly they were getting back into the game of elective surgeries. Another group of organizations that were hit financially with this was primary care physicians. They are not seeing the numbers of patients, and a study by Frisia basically showed that while it is on the upswing, first, you have a gap of April and May when virtually everything was closed. And it is very hard to make up for that reduction in pent-up demand later. And so to this point, we are not seeing that it has come back up to what pre-COVID levels. So now we're even operating at about 10% below that here in July. And it's unclear where we're going to go from here as cases in some parts of the country get much, much worse.
Yeah, I think with the July surge in cases and hospitalizations and death, that the whole idea of a rebound of medical services and utilization has been, certainly called into question, and it looks shaky as a proposition. And I think you also discuss in the paper that rural hospitals have been hit, the small hospitals perhaps who went into this with not the best balance sheets. And I think you said that there are about 10 rural hospitals that have closed.
That's right. Basically, over time, rural hospitals have been closing, and this has been a major issue in U.S. healthcare for a long time. And what COVID has done is it has sort of expedited whatever financial trouble there was in many of these institutions was basically exacerbated by the COVID crisis, because it basically took financially distressed institutions and cut off revenue for a period of time, whether it was just March, April, and May, or whether it was a longer period of time. So it basically put those on the margins, even more so on the margins, and many have just decided to close as a result.
Yeah, I guess it's sort of a tipping point
Exactly.
dynamic. So, but the meat of the paper is about what's happened to the revenues and to the profits of insurers, and you focus on the publicly traded health plans like United Healthcare in particular, and Anthem, that have reported QT results, and they are, to put it somewhat mildly, awash in profits. So maybe you could just share some of the numbers and tell us what are some of the reasons for these good times that they're experiencing, and the results we're seeing so far are Q2 results.
Sure. So if we look at five of the biggest for-profit health plans, we see that on average, their net income increased 136% between Q2, the most recent quarter of 2020, relative to Q2 of 2019. Now, it's not that the health plans were not doing well a year ago, but they are doing double or more better than they were. And the reason for this, it makes a lot of sense, because if all of those elective procedures went away, we are all still paying the same premium that we were last year or earlier in the year pre-COVID. So that money all stays as retained earnings for the health plans. Now, if you have a lot of ASO business, these health plans are not taking a lot of risk. So that could be responsive for some of the differential. In other words, some plans are more focused on their ASO business, and so they're not going to retain as much of the profit. But for the health plans like Centene, that is primarily government funded, they're taking on the risk, and so they are reaping the rewards of not providing services or services not being available.
So revenues like this, expenditures down like this, bigger gap.
It is as simple as that. And we wrote this paper because we were sort of seeing this happening, and what I was seeing was headlines saying how badly the hospitals were doing, which was counterintuitive, and then not too many headlines talking about how well the health plans were doing, but they certainly showed up in the quarterly reports, right? Because these for-profit health plans, they have to file reports quarterly of how they're doing. And so they do get discussed, but there's not as many health plans, because if you're a health plan, you sort of don't want to make it public that in an economy that is declining by 10%, that you're rolling in money. And you haven't declined, right? Even though people are utilizing less services, you haven't decreased some of the premiums. There are actually some plans that are taking some minor steps like this. It's few and far between, but some of them are promising some refunds to rebates to institutions that are paying for this. And some are also trying to help because, what a health plan services is in part the network. And if the network goes out of business, you don't have much of a health plan. So they do have it in their best interest to make sure that the network stays afloat.
Yeah, I've heard of some safety net health plans that have trying to get some money out the door, so to speak, in order to preserve their networks. So let's just put some numbers on this. I think you reported, and this of course has been publicly reported, but you did some extra math perhaps, that relative to Q2, I believe we're talking net income here, is that right?
Yes.
That the percentage increase in net income for United Healthcare was 95% of Q2 2020 compared to Q2 2019, Anthem was even higher. It was, I believe, 283% difference.
Yes.
Cigna was a bit of an outlier at only 31%, still a big increase in normal times, but relative to Anthem and United Healthcare, it seems to be a good deal less.
Yes. So, for example, United Health Group in Q2 of 2019 was $4.7 billion in net income, and in Q2 of 2020 was $9.2 billion in income.